Have you been considering having some major dental work done? We are talking maybe something like an implant or an extraction. It might be a good time to get it done now before the holidays. Dr. Wilkinson from AOMS in today with more on why the end of the year is a good time to use those dental benefits. Use them or lose them, right?
Use them or lose them. We all pay into those dental benefits, and if we haven't used them by the end of the year, they don't recycle into the next year. So we always try to get the word out that if you paid into it, you might as well get your money's worth out of it at the end of the year. We just say make sure it happens after Thanksgiving. You need as many teeth as you can keep through Thanksgiving.
Need to get through there. So why would, let's just go through teeth extraction, because I know that's one of the bigger things. So what would qualify as somebody that needs tooth extraction?
Someone that would need a tooth extraction is someone with a chronic cavity, a failing root canal, a root fracture, symptomatic tooth that otherwise has been refractory to dental treatment, crowding issues in younger patients, pre-ortho.
So when let's keep this graphic up, because I want to go back into maybe you've damaged the tooth or some way, or there's an injury, and it is only when you can't save that tooth, right?
Pretty much. I try to talk all people into saving it if it is possible. Now, let's take into account there are more than my wishes that rule this world. So, you know, there are financial considerations. I'm sure I've run across 2 or 3 other good reasons, but you know, financially, someone may not be able to afford a root canal, a post-core, a crown, a long-term follow-up, and will choose to extract a symptomatic tooth that could otherwise be fixed.
Right.
I don't prefer it that way. I mean, we're pretty good, but yeah, I'd like to keep what the good Lord gave you for as long as possible.
Right, because it's hard to beat the real thing. But you guys have kind of the next best thing. Dental implants have come such a long way.
They almost place themselves these days.
Yeah.
I'll be out of a job when they learn to do that. But yeah, dental implants are really good. They're the closest that we can get to a natural tooth. We can't wave a wand to make a new tooth grow there, but the dental implants do afford us the ability from placing the root form implant to place in a crown that's anatomic, that's not connected like a bridge would be, that you can access both sides of it with floss. It's easily cleansable, it's very stable, and it's predictable long term.
And especially if you've got a little vacation at the end of the year, now is a good time to get in, get that appointment, get it taken care of, so that way you're not out of work. Dr. Wilkinson, we always appreciate it. If you've got any questions for our friends over at AOMS, they can definitely take care of you. You can learn more about all of the options over there at AmarilloOralSurgery.com. Dr. Wilkinson, it's always good to have you in the,
Pleasure.
in the office.